Shoulder pain can be a common issue, but when it disrupts your daily life, it could be a sign of a rotator cuff injury. Today, we'll explore what a rotator cuff injury is and how rehabilitation can help you recover.
Understanding the basics of this injury and the steps for recovery can significantly improve your quality of life.
The rotator cuff is a group of 4 muscles and their tendons that stabilize the shoulder joint and allow for its wide range of motion. A rotator cuff injury can range from inflammation and small tears to complete ruptures of the tendons. Common causes of rotator cuff injuries include acute trauma, repetitive strain from activities like sports or manual labor, and age-related degeneration. These injuries often result in pain, weakness, and limited mobility.
Engaging in high-impact sports can really put a strain on your shoulders.
Even simple daily activities become challenging as we age, and our muscles aren't what they used to be.
Symptoms of a rotator cuff injury include shoulder pain, especially when lifting or lowering the arm, weakness, and a reduced range of motion. Diagnosis typically involves a physical exam and imaging tests, such as an MRI or ultrasound.
It started with just a little pain during my usual activities, but soon I couldn't even lift my arm without feeling sharp pain.
A thorough examination and the right diagnostic imaging are crucial to determine the extent of the injury and the best treatment plan.
Rehabilitation is a key component of recovery from a rotator cuff injury. It focuses on reducing pain, restoring range of motion, and strengthening the shoulder muscles. Physiotherapist. Our main objective here is to gradually bring back your shoulder's functionality without rushing the process. Patient, I've been really looking forward to starting rehab and seeing improvements. In the initial phase, the goal is to reduce pain and inflammation. This includes rest, ice therapy, and gentle stretching exercises. Manual therapy techniques may also be used to maintain joint mobility. Physiotherapist. Let's start with some light stretches. Remember, it's important to keep these movements gentle to avoid further strain. Patient, I understand. I'll make sure to follow your guidance closely. As healing progresses, the focus shifts to restoring flexibility and beginning strength training. Isometric exercises and resistance band workouts help build muscle without putting too much strain on the shoulder. In the advanced phase, strengthening exercises become more intense, incorporating light weights. Functional training helps the patient return to daily activities or sports. The final phase involves sport-specific or work-specific exercises to ensure the shoulder is ready for the demands of daily life. Proprioceptive training enhances joint awareness to prevent future injuries. If you suspect a rotator cuff injury, don't delay. Consult a healthcare professional to start your journey to recovery today. Your path to recovery begins with the right care. Thank you for watching.